Hello, welcome to the Cottage Grove Place Facebook Live First Edition. Today, we're very excited to bring you something new, something a little different that we have not done before. We do know that some of you may be actively looking for a retirement community for yourself or for a loved one. And it's a very difficult time because a lot of communities are not, they're not taking appointments. You're not able to tour. So we wanted to come up with something fun, interactive. That way you have an idea kind of what Cottage Grove Place offers. The goal today is for you to get a good understanding of how and who Cottage Grove Place is and how we work. We want this to be very interactive, so please, at any point during the presentation, we'd love for you to throw out a question. We'd love to answer it, and we just want to have fun with this. So before we get started, I would like to introduce the team that we have with us today. To my right over here is Vicki Weave.
Hello.
She has been a life care consultant with Cottage Grove Place for 6 years. On video today, Tiki Johnson. She has been here for 1 year. And my name is Brian Kramer, and I have been with Cottage Grove Place for 4 years now. And one of our goals going back about 1.5 years is to help educate the public. There's been a lot of communities that have gone up, in the last couple years, and we just want to be able to answer your questions while you're planning for the next phase in retirement. With that being said, today's topic is, who is Cottage Grove Place? And I am going to let Vicki go into that on a little bit more detail for you.
Good afternoon, everyone. Cottage Grove Place is a continuing care retirement community, and we are also known as a life care community, which Brian mentioned. We are the only life care community in the city of Cedar Rapids and Marion area. What that means is, as far as the CCRC, as we call ourselves, is we offer everything. It's all in one place, one campus. So you start out in independent living. If you need to, you can transition to assisted living. We have assisted living memory care. We have skilled nursing care. We have a low stimulus environment for higher levels of memory support, and also rehab services, all on one campus. So it's kind of nice. You don't have to go someplace else for different levels should you need them. We have been here for about 25 years. Actually, in October, it'll be 25 years. And also we partner with a company out of Des Moines, Iowa called Life Care Services. And they're kind of our behind-the-scenes support. They do legal documents for us, make sure we're in compliance as far as the state and Medicare guidelines and those types of things, and offer like our IT support and things like that. So they're behind the scenes. They've been in this industry for 40 plus years, so we're confident in having them as a partner. To the different levels of care, I think that's one of the best things about us, is that it's just all in one place, and I think Brian would agree with that, and Tiki, and
Yep.
It's certainly a place that I would want a loved one to be.
Yep, thank you. We had a couple questions that were emailed to us before the presentation started. And, Vicki had mentioned, that we are the only life care community in the Cedar Rapids, Marion area. There is a lot of questions around life care. It's very detailed, but I'll kind of explain to you a little bit. That is the first question that came to us is, what is life care? Well, life care has a lot of different benefits to it. It's an actual product. When I explain it to people, I let them know that it's kind of like long-term care insurance, but it's not insurance. So what comes along with life care is that basically you have priority access to all levels of care if needed. So what happens is when somebody moves to Cottage Grove Place, they put down a one-time entrance fee. Vicki will go through those ranges a little bit later. So you put down an entrance fee, and then you also pay a monthly fee. The monthly fee is all-inclusive, so everything is included inside that monthly fee. So what happens is when somebody transitions to a higher level of care, basically your monthly fee stays the same no matter what level of care you go to. And Vicki, like I said, will give you an example in a little bit about that. Also, there are some great tax benefits that come along with life care. Because you're putting down an entrance fee and paying a monthly fee, that money can be used as a prepaid medical expense deduction on your taxes. So we have sheets that you can take to your accountant. They can look into those codes to see how big of a benefit it would be to you. That's a little bit about life care. There's a lot more involved with it. Would love to share that with you. If you have questions about it right now, please ask. But I'm going to have Vicki kind of go into a little bit of detail about what the cost is, and she'll give you an example and tell you how it really works when somebody lives here.
Thanks, Brian. So yes, as Brian said, we do have a one-time entrance fee. You have a couple different options. One is an estate plan. You do get the tax benefit. They start at around $135,000 and go up from there. We do have 14 different style of independent living homes, so you have several options, and there's several different price ranges for those based on their size. So just to give you an idea, a one bedroom, I'll say our Verona apartment starts at about $150,000 entrance fee, and your monthly fee, which is all inclusive, is $3,000 a month. So let's say you live here 5 years or so and you have to transition to assisted living. So what we do is we just add $840 to that $3,000, and that's what your cost will be for assisted living. If it's a couple and one of you stays in independent living, it is still that $840 just added to the $3,000. So one of you is in assisted living, one's still in independent living, and you're spending less than $4,000 a month for the two of you. Now, if you stayed in your home, which some people like to do for many reasons, then you have to leave because of a health crisis and you go to assisted living, you're going to pay the market rate price, which can be anywhere from $4,500 a month and up. So as you can see, there's a big difference. Those rates would go up every year. You would have some like a la carte charges possibly for that under a private pay rate. So there's a lot of advantages to being able to know what you're going to be spending month after month and annually.
I think going off of that, the thing to remember, and a lot of people don't know this about Cottage Grove, but the only time that you actually pay that entrance fee is when you come into independent living. That's the only time life care can actually take place, because if you look at it like a long-term care policy, you have to be healthy enough to purchase a long-term care policy. So you also have to be healthy enough and able to live independently to actually purchase life care. If somebody is out in their home and they decide to come to Cottage Grove, but they come right to assisted living, there is no entrance fee. Basically what they would do is they would just come in and pay a rental fee for every month that they live here. So I did want to clear that up because that is a question that a lot of people do ask. Also, people in the public, they can use our higher levels of care. You do not have to be a resident at Cottage Grove to have access to those higher levels of care, like assisted living, our long-term care, or our rehab. You are able to use those. So if you ever found yourself in the hospital and you're working with the hospital and where you want to go, Cottage Grove Place can be that community if you would like to go there. Also, is there anything else, Vicki, that you'd like to add as far as the cost? I think the biggest key is that your monthly fees are going to stay relatively low compared to what your independent living monthly fee is, correct?
Correct, yes. And, again, we're all well aware of our, expenses and what it costs. And if you've ever had a parent in a nursing home, you know what those costs are. And, we watch that all the time. And that's going to continue to go up. It's very expensive. So to live at Cottage Grove, you're really going to be protecting your assets, which is really important for all of us.
Yeah, I'd like to just throw out an example. Right now in skilled for long-term care, 24-hour long-term care, anywhere in town you can be looking at anywhere from, I don't know, $7,500 a month up to $10,000 a month for that care. An example at Cottage Grove, if your monthly fee is $3,000 in independent living, you would only have to add the $840 onto that $3,000 to go into long-term care in a semi-private room. So you can see the difference on what you'd be paying with life care, and that's because you put down that entrance fee to help prepay for it. So if there's any questions, please ask. We'll give you a couple seconds. If not, we'll continue on with some frequently asked questions that we see and we hear in our appointments. Got anything in there, Tiki, yet, or?
No questions yet.
Okay. I guess the first question, that I hear quite a bit, and I will throw this Vicki's way, is, a lot of people ask me, if it's like long-term care insurance, life care, what happens if I already have a long-term care policy?
That's a great question, and like Brian said, we get asked that a lot. What we ask you to do is bring that policy with you to an appointment so we can kind of look at it with you. In the end, it's most importantly talk to your agent about it, but let's say it's a limited long-term care policy that only has 3 years benefit. Then you probably should invest in the life care benefit here at Cottage Grove, because whatever your daily rate is and the limits of your policy, in the long run, you're still going to benefit and save yourself some dollars. We've seen what we call the Cadillac long-term care policy, which they don't write anymore today. We're all living longer, which is part of it. We do have some other options besides just our regular life care. So if you have one of those Cadillac policies that more than covers those higher costs, when you get to a skilled level of care, then you could do like a rental type situation.
Yeah, I think the key is to let you know that Cottage Grove Place does have multiple contract options. That would just be, we would discuss that during an appointment once we got into more detail about what your policy offers, what your financials are and that type of thing. So, but yes, it's a question that we receive a lot. We've heard a lot in the last year and a half, 2 years. So if you do have a long-term care policy, please, don't hesitate to reach out to us. We'd love to help you through it and answer any questions about that.
So another question that, we have any questions, Tiki? No?
Not yet.
So another question that we frequently get asked, Brian, is what happens if I run out of money?
That's also a great question. When anybody moves to Cottage Grove, we do a financial background check. The reason we do that is because we want to make sure that the money that you have will last you the rest of your life. That is our goal. And when somebody comes in, that's a major part of what we look at besides health. We look at age and we look at your financials. A lot of places will say, or people will say, well, so-and-so says I would have to leave if I ran out of money. Cottage Grove's contracts state that if you run out of money while you live here and you come through the life care product, we will never ask you to leave. We will make sure that we take care of you no matter what. But that's why we do the financial background. We don't want you to run out of money. That's what Life Care is for. That way you know what you're spending monthly from the day that you walk in till the day you leave. So does that answer that kind of question?
Mm-hmm.
Yeah. Okay.
Good job. Good job.
Another question that we do often see is, in Life Care, when you come in independent living, what does priority access to higher levels of care mean?
So priority access, because you are a resident of Cottage Grove Place and started out in independent living, should you have a sudden health change, you're going to have first priority access to go to assisted living or the skilled nursing area, versus if you were someone in your home who had a health crisis and your doctor said, no, you need to live in assisted living now or go to the nursing home. If we have space available, most certainly we will take you. If we do not, it's because our residents have had that priority access, which really, if you think about it, that's a great peace of mind, not only for yourself, but we have found it's like a gift to your adult children. You know, it's best if you make those decisions, which we'll talk about next week in planning for your future. But it's just, you know, my mom lives in a community in Ames, and I know that she's being taken care of. You know, the staff there, they communicate with all of the family, and I don't worry about her like I did when she was living on the farm by herself for so long. So it's just, to me, that was the best decision that she ever made. It was kind of interesting because she called me one day and asked me, because she does have long-term care insurance, if I had her policy, which I did, and I said, why? And she's, well, I think I'm going to move. I'm like, yay, clapping in the background. But it really was a good move for her, especially if you live alone. The socialization is a huge thing, and she's just blossomed. So, you know, I think Cottage Grove has the best of everything. You know, I'd have my mom here. She would move to, she calls it the big city, but she won't, and that's okay. But we do. We have the best of all worlds. We actually have a resident, he's maybe lived here 5 months maybe, but more than once he stopped like Tiki and I in the hallway, and he said, you know, people are missing the boat on Cottage Grove. And we said, well, why is that? And he goes, it's the best deal in town. You know where your money's going. So that's something to seriously look at.
Yeah, just to piggyback off real quick of what Vicki was saying, you know, you can live in your home, and a lot of people want to live in their home. But when it comes time, you can have all the money in the world, you can have long-term care insurance, but when you need a higher level of care, you have to have a place to go. And that's what the priority access does, and that's what we do at Cottage Grove Place. You know, when that happens, usually it's a very stressful situation. It's a crisis situation if those higher levels of care are needed, and you are out searching and you can't find a place because everything's full. That's what the priority access is that if you come to Cottage Grove Place, you know that if anything happens, we have you, and we are going to get you basically put into the right level that you need to go to. So I wanted to piggyback off that a little bit.
Sure.
If there's any questions, if there's anything that we have right now, that's a little glimpse about Cottage Grove. We don't want to make this too long, but if you have questions after the fact, it's okay. Please contact us. I'm going to have Vicki kind of let you know what we have coming up. We will try to do these once a week. So if you'd like to let friends know, family members know, if they'd like to get on and watch, that'd be great. I'd like to thank you for joining us, and I will let Vicki kind of let you know what's coming up as far as events go in the near future.
Thanks, Brian. Yes, again, thank you for attending this afternoon. It's been a great experience for us and something new and different. Next week's topic, we're going to be talking about, do you have a plan and what that all entails? You can contact us if you want more information. Go to our website. You will be able to take virtual tours, look at apartment floor plans. There's a financial tool on there that kind of helps people decide what would be the best fit for them, and then we can do more detailed work after that. But the website will have a good wealth of information for you. There's a place where you can reach out to us on there as well. So please ask your questions. Feel free to call us. We'd love to tell you more about our community. And thanks again.
Last thing, going forward for next week's topic, I would really like you to think about, what is your plan? If you're living at home, you plan on staying at home, which is aging in place. What is your plan if something were to happen? Those are some of the things that we'll talk about next week. So I think it's very important to know, and for your family to know, what those steps are. Thanks again. We'll see you next week.
Bye.